Focus. Ideate. Innovate. Enable.
A disease that today affects over 400 million people worldwide, that has caused millions of deaths, with the toll number on the rise, and that is especially prevalent in developing countries like India. Diabetes is one of the most formidable silent killer diseases in the world today. Welcome to Live Well with Diabetes. I'm Devina Lasson, and through this series, we are going to get an in-depth look at facts, dispel myths, and understand how early intervention and diagnosis are the starting points for prevention and living well with diabetes. To kickstart the series, we're coming to you from Delhi with 3 medical experts on our panel. We have with us Dr. Surendra Kumar, with 30 years of experience in the field of endocrinology. Dr. Surendra Kumar is a prominent consultant in endocrinology from Delhi and is associated with Sir Ganga Ram Hospital. We have Dr. S.K. Wagnu. Dr. Wagnu is a senior consultant in endocrinology at the Apollo Center for Obesity, Diabetes and Endocrinology in New Delhi, and he's also the academic coordinator for DNB Endocrinology program at the Apollo Hospital. And we have with us Dr. Bansali. Dr. Bansali is presently the professor and head of endocrinology and metabolism at Postgraduate Institute of Medical Education and Research, Chandigarh. Welcome, gentlemen. So, gentlemen, we're here today to discuss the facts about diabetes. We want to dispel some myths, and we want to talk about the process of diagnosis. Now, according to a recent report by World Health Organization, in India alone, between 2000 and 2013, the amount of patients of diabetes has doubled, from about 32 million to 63 million. And the report also goes on to say that the number of patients will increase to over 100 million by 2030. So bottom line, clearly this is a very prominent and a very widespread problem in India. Dr. Kumar, let's start with you, and let's just start at the top. What is diabetes? What are the different types of diabetes, and who is prone to being a patient of diabetes?
Right. In simple terms, diabetes means the blood sugar in individuals' blood level has gone beyond a certain level. When we call it, say, fasting more than 126, and after meal, say, close to or more than 180, we call it diabetes. But then the story doesn't end here. It truly begins here. There is a state which is associated before that, and that is called pre-diabetes, because all the complications take their foothold during this period. It is predominantly for common man, public. There are only 2 types of diabetes. One is type 1 diabetes and the type 2 diabetes. Majority, when we talk about diabetes, in general, we refer to type 2 diabetes. But type 1 diabetes is increasing now gradually and is close to, say, between 5 to 10% of all the diabetes are type 1 diabetes, which are mostly in children. And here, the cells which produce insulin, they are dead. Onset is rather rapid, so this type 1 diabetes which requires predominantly insulin. But in type 2 diabetes, multiple factors take place. Genes play a very important role, environment play a very important role, obesity, etc. All those things play important role. So multiple factors are involved in causation of type 2 diabetes, hence in the treatment, multiple factors have to be looked into. Family history of diabetes is probably the most important factor, followed by the age of the person, followed by obesity, inactivity. If a person is hypertensive or having cholesterol problem, they are at a greater risk. Again, people who are at the time of birth were underweight or overweight, they are at a much greater risk for developing diabetes. And if a lady during pregnancy has developed diabetes, this lady is at much greater risk for developing diabetes.
Okay. So, Dr. Wagnu, now we've just discussed all the risk factors, but also what are some of the signs and symptoms? Say, for example, if a patient does not have diabetes in the family, you would not assume it's genetics. What are some of the symptoms that people should look out for, and are these age-specific as well?
Unfortunately, the majority of the diabetics, they come to know about their diabetes all of a sudden. They are mostly asymptomatic. We don't have any symptoms. If somebody is having diabetes, accidentally or incidentally he does his blood sugar, comes to know, oh my God, it is 350. It's a shock to his life. No symptoms at all. But in certain patients, the unexplained weight loss, despite the appetite is okay, the healing of the wound or recurrent infections. In female, the commonest infection is the vulvovaginitis. And in the male, the commonest infection they present at the onset of diabetes is balanitis. So these are some of the common symptoms, except the type 1, what Dr. Kumar said, at the early onset, they have a significant weight loss, and do the sugar is sky high, then they take the advice of the doctor.
We've mentioned a lot of the symptoms, but now Dr. Kumar started by saying that there's type 1 diabetes and type 2.
Yeah.
So which of these symptoms are specific to which
Both
type
type
of
1 and
diabetes?
I'll just specify further that the diabetes can occur at any age. You can have as early as even at 1 month of age, and you can have as late as even at 90 years of age. So if it is occurring, say, below 6 months of age, then what we call as a neonatal diabetes. That's a different. That is uncommon, in fact. But if you have a diabetes usually in an adolescent period or in a younger age group, so like say 3 to 6 years or 3 to 7 years, it is usually type 1 diabetes. And the type 1 diabetes usually have a explosive presentation. They come with a severe weight loss, very high blood glucose, and if remain undiagnosed, they usually slip into a state which is called as they become unconscious and called as diabetic ketoacidosis. While patients with type 2 diabetes, which usually occurs around the age of 40 to 50 years, and as Dr. Wangnu rightly pointed out that half of the patients are usually asymptomatic. Yeah. You know, even with our own data of 1,500 patients of a newly diagnosed type 2 diabetes, half of the patients were asymptomatic.
So, but speaking of this is a very serious problem.
Yeah.
It is after all known as the silent killer disease.
Silent, exactly.
So what is the process of diagnosis? How does it work? Yes, they might happen to take a blood test and find out. What is the process of diagnosis?
The process of diagnosing of a diabetes, it revolves around the numerical values. So you have to have your blood glucose estimation. And there are 4 important criteria which I think everyone is now aware, and most of the people are made aware of this fact that if your fasting sugar is more than 126, if your random sugar is more than 200, or if you do a blood glucose, if you're taking a blood glucose after taking 75 gram glucose, it is more than 200, or if the 3 months blood glucose, that is hemoglobin A1C, which we usually use for monitoring but also use for diagnosis, if it is more than 6.5, if you fulfill any one of the criteria of this, then you say person is having a diabetes.
Add one thing, every person will not go for the blood test. That is one thing. Who are the patients, what Dr. Kumar said, where they should know that they are at risk of developing diabetes. So somebody tell the Indian risk, in general, risk scores. Family history of diabetes, age factor, if they smoke, they drink alcohol, the waist circumference is high, physical inactivity, sedentary lifestyle. It's very important.
Dr. Kumar, what are some of the myths that exist around diabetes? For example, people just assume if they have a high sugar intake, they would think they are very susceptible to diabetes. Is this true? There are a lot of myths. So could you dispel some of the myths, and what are the absolute facts of diabetes?
Right. The major myths are that once a person is on insulin, always on insulin. That is not true in case of type 2 diabetes. On the contrary, the fact is that if there is type 2 diabetes, start insulin early, it could be for a very short duration, and after that the patient can be off insulin for maybe rest of their life. Second biggest myth is about the food. People think that the potatoes are bad, the rice is bad, the sugar is bad. Truly speaking, nothing is bad. That the word is, there is no such term as diabetic diet. It's a normal, traditional, healthy diet to which a person is used to right from childhood onward. 2 things which should be understood is, one is called glycemic index, which was very famous earlier, that potatoes have got very high glycemic index. You can bring it down, you can add a lot of leafy vegetables in that. But now the concept is glycemic load, that how many calories at one time you are putting into your stomach.
Right.
I will add 2 more things about the myths about the diabetes. The one which we discussed, that diabetes can occur at any age. Usually people don't believe that the diabetes can occur even in a younger children, or as I mentioned, even in a child of a 1 month of age. So diabetes can occur at any age. Secondly, usually the people ask, and usually people goes for some pranayama and some other Ayurvedic treatment or alternative treatment, and they say that your insulin will be omitted. But remember, in a patient with type 1 diabetes, if you dare to omit insulin, the omission of insulin in type 1 diabetes is suicidal. The third myth is about that the people usually think that the insulin is the last resort in the management of diabetes, which is not true. Because the many patients of type 2 diabetes, even at diagnosis, they may be started with insulin to help the pancreas to produce more insulin in the future. And once on insulin, always insulin, that is also a myth in the people's mind, which you can give insulin for 3 months, 6 months. Once you control the blood glucose, again they can be switched back to the oral tablets.
I'll give the last myth.
Yeah.
People think this is the end of the life. This is social stigma. If they have a control, they can do everything.
Dr. Wagner, how would you as a doctor treat a patient who has had diabetes for a long time? How would you treat him differently as opposed to a newly diagnosed patient?
Yes, this is a very important question. The moment patient is diagnosed to be diabetic, the current recommendation, treat them aggressively.
Right.
If you treat them aggressively from the very beginning, from the day one, you are going to prevent the long-term complication. What does the aggressive means? You keep the sugar target as close to the normal. The second important thing, keep your blood pressure on target. And the patients who develop diabetes is for a long duration of diabetes. There are certain complications which usually affects majority of the diabetics, involving eyes, the heart, the kidneys, and the nerves. So we tell all the patients that when we treat the patients who is already a known diabetic, not to only see at the sugar, we had to screen and diagnose what complication he has got because of the long-standing diabetes.
The one major difference between a newly diagnosed versus a late diagnosis, it is the most amenable to treatment if you intervene early.
Absolutely.
It becomes very difficult to treat those patients who comes late with a lot of complications.
Now that we're on this topic of complications that are a result of not diagnosing diabetes in advance, there have also been several cases of diabetic retinopathy that have been increasing tremendously over the years. So can you tell us a little bit about this specific problem and what are the other problems that really are the cause of concern more and more in today's day and age?
There are three main organs in the body where the diabetes usually affects. One is your retina, second is your kidney, third is your nerves, and fourth is your cardiovascular system. So these four systems have to be taken care into that. The patients usually with the retinopathy, they may come with a sudden vision loss, which is usually painless, or they may come with a progressive diminution of a vision, and sometimes they may have even retinal hemorrhages. Unfortunately, the cardiovascular complications where we put a lot of stress on that, the majority of diabetics, in fact, they usually come with a painless MI, the painless heart attack. And why they usually have a painless? Because they do have a involvement of the nerves which are supplying to the heart, so they do not experience pain and they come with a heart attack. We should try to make a diabetes-free India. And why we should try to make a diabetes-free India? It is difficult to treat after the onset of diabetes. It is easier to manipulate the things when you are in a pre-diabetic state.
At one point here, nowadays the people are coming openly and they don't talk about their sexual dysfunction. It has become a very common thing among diabetics, which most of the people often are ashamed to discuss with the doctor.
Those who got those erectile dysfunction, etc., this is a group which is more prone for a heart problem also.
Sure.
So early symptom, if he is told to the doctor, he can look after not only that part, but also may prevent a heart attack, etc.
Yeah, absolutely. Dr. Kumar, now there's a few terms that are associated with diabetes. If you can just sort of break these down for us, what exactly is hypoglycemia and hyperglycemia? What are these and how can they be prevented?
When the blood sugar falls below a critical level, for a diabetic it could be less than 90. Or other percent it could be less than 70 also, but definitely before 70 one should be very careful that not to wait for the symptom but to treat even otherwise. When there is drop in blood sugar, the whole body starts trembling. So early warning symptoms like tremors, palpitation, restlessness, anxiety, heart beating fast, sense of hunger, and all those are important. Preventing further hypoglycemia is as important as treating hypoglycemia.
Yep.
So this is hypoglycemia.
Okay.
Hyperglycemia means anything beyond a certain level, could be above 110, one should take action, about 126 diabetes. So any value above normal is called hyperglycemia.
If your kidney function starts declining, the first manifestation is manifested as a hypoglycemia. Similarly, if the patient is developing hypothyroidism, if the thyroid does not start functioning, they may again manifest with hypoglycemia.
We tell all our patients, whosoever, whether he's on a medical management or insulin, to carry always with them the glucose tablets or the glucose powder or some candies or when they're traveling anywhere. If you prevent a single episode of hypoglycemia, that is the most important thing, the home remedies.
Dr. Wagner, let's talk about the correlation between diabetes and diet. What we've established through everyone's advice so far is really, it's not just about the sugar levels. You have a normal diet actually when you are a patient of diabetes. So what is the correlation and what would your advice be to diabetes patients?
Basically, what is diet means the amount of calories you are taking. And amount of calories are basically important depending upon the body weight, what kind of physical activity you are doing, which will ultimately be correlated with the blood sugar values. Tell the patient only to avoid those substances which gives you instant calories.
Is there anything in particular that you should boost in your diet to help with?
Lot of green vegetables, fiber in the diet, fruits, cereals. These things you should add in with the diet.
But Dr. Bhansali, let's also talk about the other lifestyle aspect. It's not only diet, it's also exercise, right? Like with any disease, if you have a very balanced diet but you do not complement it with the right exercise. So what is your advice in terms of exercise?
I say on that every diabetic or even every healthy individual, in fact, should go for an exercise plan, and that usually includes a 30 minutes brisk walk 5 times a week.
Right.
Those who already having a cardiovascular disease, those who are elderly, who cannot go for a brisk walk, we have got alternative exercises. We always say the brisk walk is the best exercise, but for those who do not do like that, they can do bicycling, they can do swimming if possible, they can play the tennis, they can do dancing, they can do skating. So any sort of exercise can be done which is permissible by the patients, by their own physical abilities.
Elderly patients go for gardening also. That's one of the very good for the elderly patients. The simple gardening in their house can add to the exercise.
Dr. Kumar, there are also some other lifestyle factors that do impact diabetes, like for example smoking and drinking. So what would your advice be when it comes to these activities?
Probably smoking is the worst. Smoking not only affects the person who is smoking, but his friends, his children and his family members also. Secondly is about the alcohol. Alcohol best avoided if possible. It's not that alcohol has got...
Is there a direct impact between alcohol consumption and, say, your condition of diabetes getting worse?
No, it's a very tricky situation. Firstly, most diabetics, they got a fatty liver. Now, if on the top of that, if alcohol is added, that fatty liver disease becomes aggravated, and then it's more likely to become more chronic and cirrhosis, etc.
Let's go back to a very fundamental topic, which is weight gain and body weight. What is the correlation between your body weight and diabetes?
The obesity or overweight runs parallel with the onset and the prevalence of diabetes. Obesity per se causes insulin resistance. In Indian population, one thing is very clear. It is not obesity which is important. We call it thin fat Indian phenotype. Thin fat.
Central obesity.
The fat around your tummy.
Right.
That is the most important. Or the body mass index may be same, but our body intra-abdominal and intra-body fat is much higher, which leads to insulin resistance.
Sure.
That is we are prone to develop diabetes at a younger age.
More you have got a predisposition to become a diabetic. That's why the overweight is one of the important risk factors for developing a future diabetes.
But Dr. Bhansali, can you also finally tell us a little more specifically, what is the desired blood glucose level that you recommend a diabetes patient must maintain?
So diabetic should have for a good glycemic control, we say that if your 3 months blood glucose profile, that is your hemoglobin A1C, should be below 7%. One. If your fasting plasma glucose, if you measure, which you can do by even a glucometer, should be between 80 to 130 milligram per deciliter. And if you do after 2 hours after meal, it should be less than 180 milligram per deciliter. If you maintain the blood glucose in this range, this has got a long-term implication to prevent diabetic complications.
Okay. So basically, to summarize, keeping under control your blood pressure, your cholesterol, to start with early diagnosis of diabetes in the first place, avoiding things like smoking, drinking. These are sort of our key takeaways, lifestyle changes, and just in general diet and health changes that people should keep in mind. Gentlemen, thank you so much. In one line, is there any closing statements that you would like to give?
Remember, all the patients should follow ABCD rule. A means to keep your HbA1c less than 7. B means to keep your blood pressure less than 140/90. C means to keep your bad cholesterol, the LDL, less than 90. D means do your diet as a healthy, balanced diet. E means exercise regularly as told by Dr. Bhansali. And F, keep your foot always under check.
The diabetes should be considered as a boon rather than a curse. The reason for that, if you have a diabetes, you have an opportunity to see your doctor so frequently, so most of the medical problems which emerges can be easily resolved. And if you do that, then your longer life expectancy is definitely awaited.
Fantastic.
The old saying that take time by 4 locks. Take diabetes of 4 locks. If there is one member in the family having diabetes, all the members, both the greater and smaller members, all should be investigated regularly every year so that the early diagnosis could be made. So lifestyle, monitoring and diet and drugs, all 3 components must be looked into, and then the life is really free from symptoms and can be comfortable life.
Okay. Well, fantastic. Thank you so much, doctors. Thank you for joining us today.
Thank you, Devina.
Thank you. Well, that's all we have for you on the first episode of Live Well with Diabetes. But do stay tuned to the channel as we travel across the country to get more expert insight into preventing, battling and staying healthy with diabetes. Until the next time, from the entire team, many thanks for watching.
Focus. Ideate. Innovate. Enable.